Well, hello there. Welcome to my ASMR clinic. Please have a seat. I am Dr. Maker. Nice to meet you. So, how can I help you today? You've got an appointment. Perfect. May I know your name? And the time. Okay, you're about in time. Thank you for your punctuality. Okay, so as I can see, today's your detailed, classic, standard cranial nerve examination. Am I correct? Perfect. And I also can see that you've done it before many times. Yes? Perfect. So just in case, can you confirm me your full name? Your date of birth? It's obviously the same as before. Perfect. And your address? It's the same. Your phone number? The same. Email? Everything? The same. Perfect. May I know, do you have any concerns about your nervous system? Let's start with this one. How well can you sleep? Overall, how is your night sleep? So, do you have any headaches? Okay, how often? Okay, so which pills do you actually take? Ibuprofen? Okay, that's common. Anything else? How is your vision? Do you experience any kind of double vision? Blurry? Any kind of dryness in your eyes? Redness, I see. So, pain when you move your eyeballs, for example? No? That's good. Do you have any problems with your hearing? For example, you do not hear some kind of sounds, some frequencies? No, you don't know. Okay. We'll check your hearing with your ears just a little bit later. Yes. Okay. How well can you smell? So, do you experience any problems with your smell? So you can't recognize the common smells, for example, something like so. Okay, so far so good. Any problems with your sense of touch? Any numbness in, for example, certain areas on your skin, your face, neck? No. Good. And Did you have any kind of head traumas in your past? Surgeries? Concussion? Okay, so maybe you want to add something that we haven't mentioned yet. Okay, so it seems everything quite normal. We just need to perform a standard cranial nerve exam, and let's start with a pair of gloves. Okay, so while I'm putting my gloves on, may I ask you just to sit a little bit closer to me, just slightly, like so. Thank you very much. Just to make the examination a little bit easier. Yeah, then I can easily reach your face, your ears. Okay, thank you very much. We start with your sense of touch, if you don't mind. I'm going to be touching your face. Are you okay with that? Okay, good. So, otherwise, I couldn't perform the exam. Yes. Okay, so do you feel my fingers on your face? You do? Perfect. Okay, when I'm pressing my fingers here, can you feel it? Good. Okay. Can you raise your eyebrows? Okay, now frown. Like so. Perfect. Okay, can you puff out your cheeks? Yes, make them round. Just like so. Perfect. That's it. Can you make lips like so? That's it. Can you stick out your tongue as far as you can? Okay, I've got a glass of water. May I ask you just to take a sip and swallow it? Yes, just a nice sip. And wait a second. Hold on. Now swallow. Everything is okay. Can you stick out your tongue for me? Again. As far as you can. Can you say that's it. Can you make your tone like so? Yes, like so. You can't? Okay. That's completely fine. That is completely fine. So, can you stare at me like can you open your eyes widely as you can? Like, yes, like so. That's it. So now I'm going to perform a simple touching test. So for that I'm gonna need a couple of items. This one is let's call it a wheel. Okay, touch it. So going to be touching you, and can you feel it? And I'm gonna be touching you with this needle. Yes, it is sharp, but it won't hurt you. Don't worry. Can you spot the difference between the items? Can you feel it? This is sharp. We will call it sharp, and this is dull and cold. Yes. So may I ask you just to cover your eyes, or if you don't want to cover them, just do not look at the items while I'm touching you. Yes. Okay. Let's leave them open. Okay. I'm touching you. Did you feel it? And what object was that? Dull and cold. We just may call it dull. Yeah, for short. Okay, look at me again. Did you feel it? And where was it? Your cheek. And what object was that? The needle. Perfect, perfect. Keep looking at me. Did you get it? What was that? A wheel. Okay. And your nose. Okay. Keep looking at me. Did you feel it? The wheel again. And okay. Did you get this one? And what was that? The needle. And where? The tip of your nose. Okay. Keep looking at me. Did you feel it? And where was that? Both cheeks. And both. Okay. And did you feel it? Which one? Your right temple and the sharp one, and okay, the other temple and the dull one. Perfect, perfect. And for the last time, did you feel it? And where was that? Your neck. And what object? The needle. Perfect, perfect. Alright, now I'm gonna be pressing your shoulders down with my hands like so. And I want you to resist the pressure. Yeah, just shrug your shoulders up. And on count 3, I'm gonna be pushing them and you resist, okay? 1, 2, 3. That's it. And again, 1, 2, 3. That's it. May I ask you to touch your tip of your nose with your fingers? Yes, like so. With your right hand, with your left hand. Yes, just like so. Just keep touching your nose. And if you close your eyes, just close them. Can you touch the tip of your nose? Yes, with your right hand and with your left hand. Open your eyes, everything is good. May I ask you just to touch my tip of the finger firstly, then the tip of your nose with both hands, like so. Yes, my fingers first to your nose with this and to your nose. That's it. Can I do it like so? With your finger, with this one, with your other hand, and with this finger, and with the other hand. Yes, real quick. As quickly as you can, and with both hands, with these fingers. Can you do like so? Okay, perfect. And we move on to your ears. Let's touch them first. I want to examine them like so. I'm gonna be palpating them. Yes. And if you feel, yes, you do know what I'm going to say. If you feel any kind of pain or discomfort, just notice me, okay? Okay. So, I want you to just make sure that your ears are fine, that you just relax. Everything is fine. Let's call it a free ear massage. Yeah. Alright. Alright. So when I press my thumbs here like so, can you feel anything unusual? No? That is good. That is good. So okay. What about now? Do you feel any pain or anything unusual that you shouldn't feel? No, that is great. That is great. What about now? Everything's fine. Perfect. Perfect. So far, so good. No sign of bumps. Yes. No redness, no dryness, no inflammations. Everything seems to be very good. Let's put it like so. And okay. So just a little bit more here. And okay, now I'm going to need my flashlight. So I need to shine the light. I'm not going to examine your ears inside because this is not my specialty. Yeah. I'm just going to palpate your auricle again and just examine your ear canal. Yeah. The outer ear. Let's put it like so. Yes. Just a little bit. So I'm going to stick my finger in your ear canal just a little bit. Do you feel anything unusual? Any pain? No, that is it. That is good. So I want to make sure that everything is fine. Yes. No inflammations inside. And when I press in here, what do you feel now? Okay, nothing but pressure. That is the exact answer I wanted to hear. Okay. And now your right ear. Again, I'm gonna stick my finger inside of your ear canal just a little bit. Do you feel anything unusual? No? Good. Beside the finger inside of your ear. No pain? Okay. So have you been experiencing some kind of white noise? Let's put it like so inside your ears. So, yes, the white noise consistently repeating. You can consistently hear white noise, let's say it like so. You do? You have? So how bad is that? Do you find it distractive? Did it distract you? Do you concern about these white noise? So, how often do you use the headphones, the earphones in your everyday life? On a regular basis, on a daily basis. So, That might be a cause of this problem. Yes. So I'm gonna show you a simple trick just to get rid of this white noise. You need a finger. Yes. You need to stick the finger inside of your ear canal. Yes, and then slowly turn it. Yes, clockwise. It doesn't matter. Just it's gonna be comfortable and convenient for you. Just turn it and then slightly tilt your head to the side to the side of your hand, and then make this movement. Yes, and then carefully put it out. Can you do it now? Yes, and slightly tilt your head and do it like so. That's enough, and carefully stick it out. Yes, and the white noise is gone. And you can do it with your other hand. Let's do it with me. Stick in, the finger, turn it around like so, and yes, make it like so, and carefully stick it out, and it's gone again. A simple trick. Alright, now we're ready to check your hearing. Okay, I'm gonna be whispering the numbers. Yes, as you may know. Yeah, I'm gonna be whispering like so the numbers, and I want you to listen to me very carefully. Yes, remember the numbers and repeat them back. Okay, 5, 3, 1. 5, 3, 1. Perfect. And this side, 3, 8, 4. 3, 8, 4. That's a good result. All right. 10, 15, 2. 10, 15, 2. Perfect. 7, 8, 9. 7, 8, 9. Good job. And 21, 44, 12. 21, 44, 12. Perfect. And this side, 10, 50, 40. 10, 50, 40. Perfect. All right. Let's test your hearing with very, very quiet whisper. Let's call it like so, yeah? Okay, can you still hear me? Perfect. So, 7, 17, 48. 7, 17, 48. Good. So, can you hear me with this ear? Perfect. 11, 31, 1. 11, 31, 1. Nice, very nice. And for the last time for this side, 8, 8, 8, 18, 8, 18. Very nice. And 1, 9, 99. That's a good result. So I guess your hearing is absolutely okay. Just remember the trick. When the white noise is bothering you, just do it and everything will be fine. So we move on to the next test, which is going to be the last test for your hearing, a tuning fork test. Okay, so can you hear it with your Exactly. You can hear the vibration. Perfect. What about your right ear? Can you hear it? Mm-hmm. So now I want you to cover your, let's start with your right ear with your hand. Yes. Can you hear it with your left side? With your left ear? You can, perfect. And what about this side? Only with your left ear. Perfect. Now cover your left ear and we'll do the same. Can you hear it with your covered ear? No? Perfect. And with this side, you hear the vibration. And now I'm going to be moving it. And I want you to point me the direction of a sound. Just do not look at the tuning fork. Just point with your finger. Yes. Very good. And for the last time. Yes, perfect. And we move on to your eyes, which is your optic nerve. Okay, I'm gonna be shining the light. I want to examine your eyes firstly. So I'm gonna be shining the light. Do not look at it. It's very bright. Just try to look somewhere else. Do not look directly at the light, okay? I'm going to quickly examine your eyes to see if there are any sign of redness, any sign of dryness, and to check your pupil dilation. Yes. Do not look at the light. I know it's almost impossible to not look at the light when it's in front of your face, but do not look at the bright spot. Just look somewhere else. Alright. Everything looks quite good to me. No sign of redness. Can you just blink? Yes, that is it. And again, your left eye looks good as well. No sign of redness. Can't spot any dryness, which is a very good sign. Okay, and your pupils react to the bright light. Let's say properly. Yes. Look at me. Yes, I know. It's kinda. Let's see. Bluey? Yes. Concentrate on me. Okay. You may experience some vision troubles, yes, with this bright light, but it's completely fine. Blurry is okay. Now look at me. Good. So now I want you to follow the light with your eyes. We can use this bright light or this warm. Which one do you prefer? This one. Perfect. Look at the light. And follow with your eyes. Only do not move your head. Just follow the light with your eyes. Can you see the light? Well, maybe we should use this one. It's too bright. Okay. Let's leave this one. Okay, now we move closer to your face and to your eyes. Everything seems blurry, but you just the center. Okay, look at me. Yes, just blink, blink, blink. It's completely fine. Yes, blurry is okay. Yeah, the bright light, you know. Okay, and now we're going to do almost the same, but with a hammer. Yes, look at that black spot here, the black tip, and yes, keep looking, keep following with your eyes. Yes, do not move your head. Just look at the hammer, follow it wherever it goes. Yes, it's almost the same, but this time no blurry. Yes, because no bright light. Okay, good, good. And again, let's bring it closer to your face. Now, you may see everything is blurry, but just keep focusing on the hammer. Keep moving your eyes again down to this side and diagonally here and down and to this side and down to your chin and up to your forehead, now to your nose, to your right and to your left, and here diagonally to this side, to this side, to this side. Okay, up and back to center. Okay, everything's good. Can you look at my nose? Focus on the tip of my nose, and I'm gonna be wiggling. I'm gonna be moving the hammer, and I want you to tell me if you see the movement. Okay, just focus here on my nose. Do not look at the hammer. Can you see it moves? Perfect, perfect. Keep focusing here. Good. Keep looking at me. Can you see? Good, good. And perfect, perfect. Keep looking at my nose. And can you see the movement to this side and to this side? Perfect. And to this side. Perfect. Again, perfect. Keep focusing on my nose. I'm gonna be using my fingers this time. I'm gonna be moving them out of your fields of vision, and I want you just to tell me when you cannot see the fingers at all. Yeah, tell me when they disappear. Focus on my nose. Yes, and we move fingers. Yes, both are gone. Look here again. And we're moving them out. Both are gone. Keep focusing on my nose. And we try. Don't look at the fingers, please. Focus here. That's completely okay. Alright. And again. Both are gone. Keep looking here and tell me when you can see them when they reappear. Good, good. Everything's good with your optic nerve and with your vision. And that means we move on to your olfactory nerve, your sense of smell. Yeah, and your sense of taste. Yeah, we start with the sense of taste. Please take a sip of water. Yes, wash your mouth. And here I've got a liquid. Can you stick out your tongue for me? Yes, I'm gonna be drop some drops. Drop, drop, drop. Now stick it back and taste. And what's that? Something sweet? Yes, it's just sugar. Sugar in the water. Yes, sweet water. Let's put it like so. And the next one, just stick out your tongue. I'm gonna be dropping, drop, a couple of drops. Stick it back and taste. Take your time. It's salty. Yes, it's just salt. Perfect. And the last one. Give me a moment. And now stick out your tongue. Okay, drop. Stick it back and taste. Bitter, yes. It is a lemon juice. Everything is good. 3 out of 3. That's a very nice result. And we move on to your sense of smell. Yes, just breathe like so. Yes. Yeah, that's enough. That's enough. And we start with the first sample. Yes, just breathe with your both nostrils carefully, nice and easy. Can you smell it? Can you recognize the smell? Okay, let's try it this way. Can you smell it? Can you recognize it? And yes, forest, but what kind of forest exactly? Yes, we can say it like so. It is pine. Yes. Okay. The next one. Just breathe like so, just to clean your nostrils, to bring some fresh air in. Okay, now breathe carefully with both nostrils. Can you smell it? Can you recognize the smell? Okay, let's try this way again. Yes, a citrus. Yes, what kind of citrus exactly? Orange, perfect. Let's try the next one. Okay, just breathe like so again to bring some fresh air. Okay, are you ready? Yes, just make a nice deep breath in and out. Perfect. Now breathe in carefully with your both nostrils, nice and easy. Can you smell it? Do you recognize the smell? Okay, let's try this way again. And you certainly do know this smell. And what is that? A flower, perfect. And what flower exactly? It is purple. Yes. Lavender. Yes. Of course, it's lavender. Do you like the smell? Personally, I don't. Not my type of smell, not my type of flower. Yes, and the last one. This might be a little bit tricky. Yes. Just clean your nostrils and prepare them for a new smell. So do you smell it? And can you recognize the smell? Yes, something familiar. Okay. Maybe it's fruit, maybe. Or maybe. Yes. Why not? But can you be more accurate? Just tell me. Cherry, yes, yes. This one was hard to guess, but you've done it perfectly. So, yes, you can breathe like so again, but there is no samples left. So, this is it for the examination. Yes, your olfactory nerve with the other nerves, your optic, your hearing, your sense of touch, everything are completely fine. Yes, the white noise in your ears, yes, I've told you how to get rid of them. Yeah, so this is it for today's examination. Congratulations, everything is in a standard condition. Let's put it like so. So, about putting, can you put the like button down there? Yes, I'll be very grateful for this. Yes, and you may leave a comment about my work, and if you want, and consider subscribing to my ASMR clinic, which is absolutely free. Yes, thank you very much. Again, thank you for your visit and your time, and I'll see you on the next one. Goodbye, take care.